About 10 years ago, before we had a cardiac catheterization lab in Peterborough, on my own personal waiting list of patients that I had referred for that investigation, 3 to 4 people were dying every month waiting for that particular technology. Once we got the lab here in Peterborough, that death rate went down to virtually 0. What's going to happen with what the government is doing now is that the very tests that we need to do that identify who needs the cardiac catheterization, those tests won't be available. So it is inevitable that there will immediately be an increase in unnecessary death and disability simply because we didn't know a person needed to get the angiogram. In many communities, the hospitals don't have the expertise, they don't have the infrastructure, they don't have the space, they don't have the budget, they don't have the time to do the work that we've been doing in the community for 20, 25 years. Right now we're on a very slippery slope in Ontario. If the government does not reverse its position on this item specifically, the access that people in Ontario have enjoyed to diagnostic facilities in communities of all sizes, that access is going to be severely curtailed. It's inevitable. They're doing this because they want to save money, of course. They're doing this because they've been told by people who advise them that there's something wrong with self-referral. Our belief is that exactly the opposite is true. It's exactly the right way to ensure that the right test is done by the right people in the right place at the right time. We've gone to the health minister's office. We've spoken with officials, senior officials in her office. We have offered them what we think is a very appropriate and constructive alternative to that which they're planning to do. And we're disappointed, frankly, that they haven't committed to following that advice. So in the absence of a written undertaking from them not to go ahead with the self-referral deductions, people are going to have to make arrangements to shut down their facilities. We've worked very hard, and we have a very skilled staff who really care about people, and they want to do the very best for every patient every day. We can't do a good job without our tools. And effectively what's happening after July 1st is that our tools are going to be taken away from us, and we won't have the ability to provide the services that our patients need. And anything that gets in the way of us being able to provide that kind of care is very difficult for all of us. We need people to take this very seriously because we're concerned about the health of all our patients. We're concerned about the ability of all cardiologists to provide high quality care. People need to, right now, pick up the phone and call their MPP or write a letter or send an email, copy to the Premier and the Health Minister to let them know that they don't think that this is the right direction for Ontario to go. It's not safe for patients, it's not the right choice for Ontario, and they need to reverse this. It's taken 20 years for us to build these services across the province. If they're torn down, we can't build them up again overnight.